If you bill Medicaid for home care or home health, I want to talk to you today about the top 3 things that are causing denied claims for your agency. I spent some time digging into this one, pulled research, looked at what's happening across different states, and honestly just sat down with some of the billing experts I worked with and asked them, out of everything that causes a denial, what actually matters most? If you only have time to fix a few things, what are they? And a few things came up again and again. So let's get into it. Here's the honest truth first. Denials are getting a lot more common, not less. So if you feel like it's harder to get a clean claim through than it used to be, you're not imagining it. That's the trend pretty much everywhere, across pretty much every state we work with. And it's not just annoying, it's expensive. Every time a claim gets denied, somebody on your team has to stop, figure out why, fix it, and resubmit it. That's real time, and a lot of agencies honestly just don't have the bandwidth to go back and fight every single one. So that revenue just quietly disappears. So knowing that, here's what actually moves the needle. The 3 things that, if you get them right, will wipe out most of your denials. Let's start with the big one. The number one finding, and honestly the thing I'd put at the very top of your list right now, EVV. Electronic visit verification. And here's why this is number 1. A lot of states are quietly flipping a switch right now, going from what's called a soft edit to a hard edit. A soft edit means if your EVV data doesn't match up, you still get paid, you just get a warning slap on the wrist. A hard edit means no match, no payment, and an automatic denial. And states are moving towards that hard edit world fast. When state auditors go looking for unmatched EVV visits, they're finding it at a scale of billions of dollars in payments tied to visits that never had a clean electronic record. That's the level we're talking about. So what do you actually do about this? Here are 3 things our billing team swears by. Number 1, capture the visit electronically the moment it happens, not after the fact and not from memory at the end of the shift. 2, and this is something that a lot of people skip, work your exception queue at the end of every single day. If a visit is sitting there unverified, don't bill a claim off of it yet, go fix it first. And 3, actually confirm your data is making it all the way to your state's system. If you're using a different software vendor than what the state runs, double check that that data is actually transmitting successfully. Because if it's not, that visit might as well not exist as far as the state's concerned. This is honestly one of the things we obsess over at Geo. Our EVV is built to transmit cleanly to the state every time, so you're not left guessing whether a visit actually made it through or not. All right, denial reason number 2, authorization and eligibility. There are 2 ways that this can bite you. First, authorized units. Someone gets authorized for a certain number of hours a month, so your team delivers the care and everybody did their job right. But nobody was tracking that authorization was about to run out, so now you've got visits with no units left to bill against. That care already happened, your caregiver already got paid, and now you can't collect for it. That's money you don't get for no other reason than a tracking gap. Second is eligibility. And this one trips people up because they treat it like a one and done check. Medicaid eligibility isn't a set it and forget it. It moves month to month. Sometimes it changes without much warning. And if a client's coverage lapses even briefly, that window of care isn't billable, no matter how good your documentation is. Managed care plans are notorious for pushing back on prior authorizations too. And honestly, most agencies don't push back or appeal when that happens. They eat the loss and move on. That's exactly the habit you want to break. The fix here isn't complicated, it just takes discipline. Track authorized units against scheduled units weekly and set alerts at 75 and 90% used up so you're renewing before you hit the wall, not after. And verify eligibility at least on the 1st and the 15th of each month, not once at intake and never again. It's actually one of the reasons we built our authorization tracking tool the way we did at Geo. It splits out and tracks those units for you automatically, so nobody's relying on a sticky note or spreadsheet to catch it before it's too late. And one more thing, if you're working across multiple states or you've got dual eligible clients, know exactly who's getting billed for what. Managed care plan or fee for service. Medicare first, then Medicaid if it's a dual eligible case. Getting the routing wrong is one of the most common and most avoidable reasons a totally legitimate claim bounces. Honestly, this is where having a team that lives in this stuff day in and day out makes a real difference. Our billing team follows up on every claim to make sure it's actually getting paid, not just sitting out there waiting to be collected. Okay, finally, number 3, and this is the one that's the most different from state to state, so pay attention to your own state's rules specifically. Documentation and timely filing. On documentation, every service you bill needs to tie directly back to what's actually written in that person's plan of care. Not close to it, directly to it. Vague notes, missing signatures, or a service that isn't actually listed on the plan are classic audit and denial triggers. And honestly, they're some of the easiest ones to prevent. It's just about training your team on what a note actually needs to say. This is why we built our documentation features specifically around your state's requirements. So the platform is already nudging your team towards what auditors are actually going to want to see instead of leaving it up to guesswork. And then there's timely filing. This is the deadline for actually submitting the claim. And here's the thing people don't realize. Medicaid deadlines are often way shorter than Medicare's, and they're all over the map depending on your state. Some states give you close to a year, and others give you as little as 3 months. And if you miss it, in almost every case, that money is gone. So my advice, don't wait until you're close to your state's deadline to submit or correct a claim. Build a weekly submission habit and treat the midpoint of your filing window like it's the real deadline, not the actual end date. And honestly, this is one of the best things about Geo. Billing is what we know like the back of our hand, so agencies aren't sitting there trying to keep a million different rules straight in their heads while also running a business. Alright, so to recap, and if you only take 3 things from this video, I want it to be this. Get your EVV airtight and check it daily. Keep a real-time eye on your authorization and eligibility so you're never billing on empty, and know your state-specific documentation and timely filing rules. If this was helpful, I'd love it if you hit subscribe, and also drop a comment and let me know, what state are you billing in and what's the #1 thing that's actually been denying your claims? Thanks for watching, and we'll see you in the next one.